think when you fear something, it sort of takes on its own life. And then, everything over a period of a couple of decades, in my head was turning into cancer. I was afraid to go check on a sore throat. I was afraid if I had a pain in my elbow. And the panic attacks that I had when I went into urgent cares or just regular checkups were really unbearable.
Stephanie Anderson's fear of cancer is understandable.
My grandmother had breast cancer. My mother had breast cancer and passed away just before my 12th birthday.
So at the age of 34, she began meeting with Donna Lamp at Penn State Health St. Joseph Cancer Center.
Our cancer risk evaluation program is really for anyone who wants to assess their risk of cancer based on their own personal risk factors and also on their family history of cancers. And they want to know what their risk is, and they want to take some action steps, to really be ahead of cancer versus waiting until it happens.
Stephanie and Donna walked through her family history. She had a blood test to determine her genetic risk.
So Stephanie actually had a pretty comprehensive panel of genetic testing. And believe it or not, that was all negative.
Her genetic risk was low, but her overall risk was 20%, which meets National Breast Cancer Guidelines for MRI screenings.
I think it was, just knowing literally I'm looking for this and I'm not hiding from it anymore, but also sort of psychologically and emotionally to face your fears, I think almost creates this courage. It's like you set it in motion and you're like, yeah, I'm tough. I can do this. I can go in there. I'm, cancer centers, I can get familiar with this. And so the more I went in, the easier it became.
For 4 years, Donna was there for her MRIs and her screening appointments.
Based on the general population, her risk of breast cancer was higher than the average person. And so we knew she needed increased surveillance. And so it was the breast MRI that actually detected a very early breast cancer for her.
I went in 2019 and I remember that day because for whatever reason, I was feeling very uneasy again, almost like it was the first time going back into the cancer center. And 2 nurses came out from the back at the same time. And one of them called my name and the other one called Susan. And interestingly enough, that was my mother's name. And it sort of sent a shiver down my spine.
At that appointment, Stephanie learned she had a tumor.
I was very lucky. I had an excellent prognosis and I did not need chemotherapy. I needed hormone therapy because the cancer was fed by estrogen and progesterone. The fact that my tumor didn't have that time to flourish and grow, I think makes it much more manageable. So I went looking for it. And I, was the first person, I guess, in this program to find it. And because I found it, I stopped it before not only it could kill me, but, before it could spread through my body.
When it was time for surgery, Donna was there again.
Donna came and just stood behind me. I didn't even know she was going to be there. I was just showed up with my husband and she just came and didn't make me talk. She just stood there and put her hand on my shoulder and stayed there with me. I felt safe and supported. I don't know what her job description is, but she's, a beautiful person and incredibly supportive.
I admire her so much because she was, not only balancing her own health, but also balancing a family, a job, and, all aspects of life. And, she really wanted to have a healthy coping strategy, so rather than have this high anxiety and worry, she actually took an action plan.
I have 3 daughters, and because I've empowered myself to know, and I discovered my cancer, my 3 daughters are all that much more empowered to understand not only what their risk is, but also what they can do to protect themselves.
You heard Donna mention that genetics testing has come a long way in terms of what it can find. It's also come a long way in terms of insurance companies and how they view it. It's often now considered standard of care.